Historically, payers have been somewhat reluctant to pay for prosthetics and orthotics, primarily because there's an upfront investment and they're not confident that they'll get their investment returned in the long run, which in a certain way is unfair because if you get a heart procedure, you don't ask whether you get a return on it. You just do the heart procedure because it's a necessary medical procedure. So I think there's a certain discrimination in the marketplace for prosthetics and orthotics. And what we found is that the payer does indeed save money over a 12 to 18-month time period. We found between a 1% and 10% savings dependent upon the devices. And for the prosthetics, we found essentially a break even over a 12-month time period. Very powerful finding. The study findings are certainly a win-win proposition. The patients are much better off. They're using less hospital care. They're using less emergency room care. Hospitals are places you just don't want to go unless you absolutely have to. And what we've shown with our study is that hospitals are used less by people who are fitted to these devices. From the insurer's point of view, the insurance payer's point of view, it's essentially a save 1 to 10% proposition to break even. So they're coming out of this financially a little better off, but their patients are much better off.
I walk at least 2 miles, at least 3-4 times a week. So I do that to keep in shape. When I get up in the morning, you wash your face, I put on my prosthesis. It's me. It's me. And I'd be lost without it. It's essential as far as I'm concerned, yeah. I mean, I'm just a normal person with it. Without it, I'd have to make adjustments that I don't have to make. I mean, I would make them, but I don't have to now.
The doctors told me that if I was to take out most of my knee, then I would be able to, run and bike and do all of the things that I'd wanted to do. They're completely correct. With the prosthetic, I am able to do all of that. I played tennis, I did crew, I did swimming, I did golf, and now I really enjoy running. So running and biking. So it's been really incredible for me. And just to do the day-to-day things as well,